Everybody knows about me, and today's topic is very important and very unique and very demanding topic, and its importance remains exclusive to all of the mankind. And it is the topic which I would like to keep teaching to my students till the time I can. So, the topic of our today's class is the continuation of our lecture series, which we started back in August, and that is maternal and child health. So, it is the part two of our lecture series, Maternal and Child Health Part 2, perinatal and immediate postnatal care of mothers. So basically, if a woman gives birth to a human being, a baby, then how to take care of her in perinatal period. Perinatal means the period surrounding the birthing process, and immediate postnatal. So basically, postnatal comes within the bracket of perinatal, but we have to use the term postnatal as well, so that the emphasis remains strong. So immediate postnatal care of mothers. So that is our today's topic of discussion. So, learning objectives for today's class are introduction, basic definitions, brief summary of previous class, understanding the signs of onset of labor, when to go to hospital, stages of labor, water birth, and assisted deliveries, monitoring of the baby during labor, care after normal vaginal delivery, NVD or SVD, and C-section births. So NVD or SVD are normal vaginal delivery or spontaneous vaginal delivery. And C-section is a cesarean section, the surgery which is performed in case a woman can deliver a baby normally, then the surgery which is performed is normally routinely called C-section all around the world. Then there are some guidelines for postnatal visits of the woman who gave birth. Then we will talk about changes in body after birth, and then we will talk about common postpartum complications and how to avoid them. So, introduction is having a baby is an exciting time that often inspires women to make healthier lifestyle choices and, if indeed, work toward a healthy body weight. When a woman gets pregnant, her whole body physiology changes drastically, and there is a rush of hormonal as well as physical changes in her body, which can be challenging for many females. Taking care of a mother's health while she is pregnant is an extremely important aspect of pregnancy care, as she is not the one individual but two individuals. The way a mother's pregnancy progresses, it entirely reflects in the newborn child's health and wellness. Healthier pregnancies are associated with very less complication rates as compared to those pregnancies where mother's health and well-being was not the primary concern for the family or the healthcare providers. So basic definitions. So what is a pregnancy? Pregnancy is a condition during which one or more offspring develops inside a woman's uterus. A multiple pregnancy involves more than one offspring, such as with twins. Pregnancy usually occurs by sexual intercourse, but can also occur through assisted reproductive technology procedures. Conception, the process of becoming pregnant involving fertilization of a female egg with male sperm, followed by implantation of embryo inside woman's uterus. Yeah, fertilization occurs, and then when that fertilized embryo gets implanted inside a woman's uterus, that is called conception. Trimester, the 3 months period of time in pregnancy, they are referred to as first, second, or third. Then miscarriage, also known in medical terms as spontaneous abortion, is the death or an expulsion of an embryo or fetus before it can survive independently. The term miscarriage is sometimes used to refer to all forms of pregnancy loss and pregnancy with abortive outcomes before 20 weeks of gestation. uh, Antenatal, prenatal, or antenatal care is the health care you get while you're pregnant before the birth occurs. Postnatal care describes the care provided to the mother and her newborn, commencing from the delivery of the baby and the placenta up to 45 days or 6 to 8 weeks in some textbooks. Labor is a series of continuous progressive contractions of the uterus that help the cervix dilate and efface thin out. And this lets the fetus move through the birth canal. So that is the process of labor. So labor is a basically contractive process of uterus which helps the baby to get delivered through the birth canal of a woman. So, brief summary of our part one of this lecture series. In part one of this lecture series, we understood the concepts of pre pregnancy planning and care by both partners, then first trimester care. The importance of genetic testing was discussed in our first class. Foods to avoid in pregnancy were discussed. Exercises during pregnancy were discussed. Then, second trimester care, third trimester care, and then finally, vaccination in pregnancy was discussed. So, we will imagine that a woman has progressed all of her stages of pregnancy and now she is ready to deliver the baby. So after 37 weeks of gestation, a woman is ready to deliver at any time of God's choosing. Whenever there is God's choosing for her, she will deliver after 37 weeks of gestation. And usually, women deliver around 39 to 40 weeks of gestation. So when the gestation period is complete, then the body of the woman starts a process of expulsion of the fetus or the baby inside the womb, and that process is called the labor process, as we discussed in the basic definitions. So the signs of onset of labor are very important and they should be known by all the household ladies. The woman who is carrying a child in her womb as well as her family members should know the basic signs of onset of labor so that they know when to go to hospital. In this section, we will discuss all the details regarding the perinatal and immediate postnatal care of mothers. So, the signs of onset of labor. There are many signs that labor must be starting. Number one, contractions and tightening feelings in lower abdomen and pelvis, bloody show, which is basically blood mixed mucoid vaginal discharge, mucus filled with blood, mucoid vaginal discharge due to loss of mucus plug of the cervix. So basically, when a woman is pregnant, the cervix is sealed. The cervix is sealed off with a mucus plug. But when the onset of labor comes near, then that mucoid plug which has blocked the cervix of the woman becomes off, and it gets expelled through vagina with the vaginal discharge, and that blood mixed mucoid vaginal discharge is called bloody show. Lower back aches start, an urge to pee repeatedly, and increased urges to go to the bowel as well due to baby's head pressing on bladder and bowel as well. Water is breaking. Sometimes there is rupture of amniotic membranes as well. So it is spontaneous rupture of amniotic membranes, and that is also a sign of start of labor process. Remember that early latent stages of labor can take some time. So there might be some days of contractions and tightening feelings in mm, lower abdominal pelvis. A woman may feel these signs for 3 to 4 days. There might be a time when a bloody show happened, but the woman's true labor didn't start even after the bloody show, and then the urge to pee and urge to poop repeatedly started 3 to 4 days back, but the woman still didn't start her true labor even after the start of these symptoms. But when the waters break, then the woman's baby must be delivered within 24 hours. We will discuss the reasons for this later on. So the signs that labor is near in infographic diagram: lower back pain, nesting instinct. Nesting instinct is a motherly instinct that she is to become a mother. So she has a nesting instinct. She wants to protect her child. She wants to raise a child. So all of the love hormones are rushing in her body. All of the love hormones and caring hormones are rushing in her blood to welcome the newborn, to welcome her baby into the world. Increasing pressure in pelvis and rectum, baby dropping down into the pelvis, increased Braxton Hicks construction. Contractions. We will discuss what are Braxton Hicks contractions later on. Looser bowel movements, the water breaks, bloody show, and all of these things we have discussed. So these are the signs of onset of labor, or that labor is near. So, if a woman feels that her labor has started, then she should know when to go to hospital. It is very, very important then that the woman in her last trimester is taught to understand all of the changes happening in her body. So the difference between false labor and true labor should be known by the woman. Sometimes you may think that you are starting labor, but it's just a false alarm. You might feel contractions, but your cervix is not dilating or effacing. Even after the uterus has started contracting, you feel contractions in your lower abdomen and pelvis, but your cervix is still thick, your cervix is still sealed off, your cervix is not dilated. Cervix is the first thing where baby's head will get stuck. And cervix will let it pass, then it will let go down into the birth canal. So your cervix dilation and effacement. Effacement means the thick bands of the cervix which stop the baby's head from descending downwards. The thick bands of the cervix start become thinning out, start giving way to the baby's head. And dilation means the cervix, the mouth or the gate of the cervix, which has been stopping the baby's head from descending downwards, it starts getting dilated. So the gate starts getting opened centimeter by centimeter. False labor, also known as prodromal labor in medical terminology, can be pretty convincing and it's fairly common. False labor typically happens pretty close to your due date at 37 weeks or later. This makes it even more confusing because the woman thinks that she is 38 weeks plus, she is 39 weeks plus, and true labor's time has come. So it might be true labor, it's not something false. She's feeling pains, she's feeling contractions, so the baby is coming on her way or on his way. You may feel contractions for up to several hours that happen at regular intervals. False labor contractions are also called Braxton Hicks contractions. So the contractions which are related with the false labor, these contractions are called Braxton Hicks contractions. So basically, the scientists who did some research on these things, so they named these contractions after those people who researched this phenomenon well. So, in order to distinguish between true labor and false labor, the midwives or obstetricians guide the woman about the symptoms of true labor or false labor, where the women are not considered or women are not taught that they can't contact midwives, they can't contact their obstetrics department, they can't contact their relevant hospital when they think they are laboring, because in order to ascertain whether she is having false labor or true labor does not rest with the patient, but it should be decided by the healthcare professionals. But still, for the education purposes, the woman and the family members should know what is a false alarm and what is a true labor. So false labor, there are contractions, so in the false labor, but when a woman feels better after walking, then that contraction is a false labor contraction. But in true labor, your contractions start to get more stronger when you start walking. Yeah, in true labor, the women are encouraged to walk more and more to ease the process of labor. But that's not the case with false labor. And contraction strength It stays the same over the course of whole day in false labor, but it gets stronger over time in true labor. Contraction intervals stay the same in false labor, and they get closer together over time in true labor. For example, if a patient is suffering contractions every 30 minutes, then she will start to get contractions every 20 minutes and 15 minutes and 10 minutes and so on in true labors. But that will not be the case in false labor. She will keep having contractions after 45 minutes or after 1 hour period, and it will stay the same. Contraction locations in false labor are generally only at the front. In true labor, they begin at the back. There is severe lower back pain experienced by the woman, and then that pain comes to the front in true labor. And then vaginal discharge is not present in false labor, but in true labor, there may be some bloody discharge experienced by the woman in true labor. So these are the five major differences. There are some minor differences as well, but I cannot go into the details of all the differences because it will go out of this it will go out of the scope of this lecture. But these five main symptoms should be taught to the woman who is about to give birth. So there are some danger signs as well. So a woman should know that she needs to go to immediately to hospital, to the maternity ward when she feels or she experiences any of these danger signs. So the danger signs are painful contractions every 3 to 5 minutes. Yeah, the contractions have become so strong that they are coming every 3 to 5 minutes. That is the time when she should immediately go to the maternity ward because she may deliver anytime soon without any trained birth attendant at her side. Leaking fluids per vaginally. He has started leaking fluids per vaginally. She's leaking water and it's not going to stop if she has started leaking water. And she needs to go to the hospital immediately. Even if it's 4 a.m. in the morning, she needs to go to the hospital. She needs to go to the maternity ward where she's booked. Bright red bleeding parvaginally. Yeah, it's an extremely dangerous sign. If she feels that she's losing bright red colored blood, that means it's a fresh blood. She should immediately go to the hospital without wasting even a single minute. Her family should take it serious and they should immediately reach the hospital if she's having bright red bleeding parvaginally. And if she's feeling decreased fetal movements, or she's having severe headaches, there are some changes in visions, or there is vague, severe upper abdominal pain. So all of these signs are danger signs. If there are changes in vision, she starts to feel blackish spots in front of her eyes, or if there is vague upper abdominal pain. So these are the signs and symptoms of preeclampsia, and she may go into eclampsia. What is eclampsia? So basically, it's the start of seizures in a woman due to a placental reaction. The start of seizures might be life-threatening. So there are some signs and symptoms of eclampsia, and one of them is changes in visions and upper abdominal pain. If there is repeated vomiting or a fainting spell of the female patient or a pregnant woman, then she should also go to the hospital immediately if there is repeated vomiting or fainting. So, we will briefly discuss all the stages of labor as well. So, the first stage of labor is basically when baby starts to descend downwards. So, we will discuss the normal cases. We will not discuss some breech deliveries. We will discuss normal vaginal deliveries where baby's head is fixated into the pelvis and it's resting against the cervix. So the first stage of labor consists of two phases. I accidentally wrote three phases. Basically, there are two phases. So one is the latent phase. Cervical dilatation is 0 to 3 centimeter. It begins with regular contractions So labor pains have started, and they are true labor pains. Cervical dilatation has started, and it's 0 to 3 centimeter. Pains are similar to painful menstrual cramping and are usually accompanied by lower back pain. Contractions, number three, contractions during this phase are more than 5 minutes apart, last 25 to 30 seconds, and are considered to be mild. Usually, woman is excited about labor and talkative at that stage of labor. It's called latent stage. It usually lasts between 3 to 12 hours, being longer in nulliparous women and shorter in multiparous women. Even in nulliparous women, the latent stage of labor may be as long as 24 to 36 hours. She may experience mild contractions, mild lower back pain, and mild abdominal cramps, just like menstrual cramps, and for even 24 to 36 hours. But it is very less in multiparous women. So in stage one, and so there, the fetus starts to put pressure on the cervix, and then in the active phase, the cervix gets starting to get effaced, and it gets thinned out. Its thickness decreases, and it starts to move away, and it starts to open up. And then there is a transition phase. Uh, this transition phase is nowadays also called second stage of labor. So there are only two phases, active in latent phase and active phase in modern obstetric books. So the second phase is the active stage and describes the time between the end of the latent phase. So from 3 to 4 centimeter dilatation and full dilatation up to 10 centimeter, and it's also variable in length, usually lasting between 2 and 6 hours. Again, it is shorter in multiparous women. So the second phase of first stage of labor is active phase, and the frequency of contractions in latent stage are 5 to 10 minutely, and they might be 5 to 30 minutely as well. And the duration of contractions is less in first latent phase of first stage, and there are 20 to 35 seconds contractions. But in active phase of labor, the duration of contraction is 40 to 55 seconds. They are also more frequent. They start to happen at 3 to 5 minutely periods. And then in second stage of labor, when the baby starts to move down into the birth canal, then the frequency of contractions becomes so increase, and the contractions start to happen in every 2 to 3 minutes, and the duration of contractions is 55 to 65 seconds. So not only the frequency has increased in second stage, but also the duration of contractions and the strength of contractions also increases in the second stage of labor. So the diagram showing the cervix at the beginning of the labor and later in the active phase. So if you look at the cervix in the beginning of the labor, and when the cervix is fully dilated, so it is extremely thinned out and effaced and dilated. On the left, cervix can be seen to be fully effaced. On the right, the cervix nearly fully dilated. The woman is in active phase of labor and approaching the second stage. The membranes have ruptured. And now, second stage of labor starts from the full dilatation of the cervix, and that is 10 centimeter, and ends with expulsion of fetus from the birth canal. It has got two phases as well. One is propulsive phase, and the second is expulsive phase. The propulsive phase starts from the full dilatation up to the descent of presenting part of to the pelvic floor. So normally in normal vaginal deliveries, I'm not talking about breech deliveries, normal vaginal deliveries, the presenting part is the baby's head. They are not buttocks or some leg or something else. The presenting part is baby's head. So propulsive phase starts from full dilatation up to the descent of the presenting part to the pelvic floor, and the expulsive phase is distinguished by the maternal bearing down efforts. So maternal bearing down means the effort of the mother to deliver the head of the baby. So expulsive phase lasts till the baby's head is delivered, and after the baby's head is delivered, then The trained birth attendant, obstetrician, or a midwife, or obstetric nurse, whoever is attending the case, after the baby's head is delivered, they help the baby's body to get delivered as well. So the expulsive phase ends with the delivery of the baby. Every duration of the second stage of labor is 2 to 3 hours in primary gravida, and it is 1 hour in multipara. But again, it can be up to 4 to 6 hours in primary gravida as well. And those labors are not considered normal, but they are considered prolonged labors. But in multiparous women, usually the second stage of labor happens within 2 to 3 hours. It does not take this much long. So in the stage two birth, the baby's head has started descending. So there is presentation of the head, and you can see the baby's head when you examine the woman's birth canal through vagina. And then there is the rotation and delivery of anterior shoulder after the head is delivered. Then there is delivery of posterior shoulder. So these are the basic maneuvers which all the trained birth attendants or midwives or obstetric nurses or gynecologists are taught, and they should know. And then the delivery of the lower body of the baby and umbilical cord. So umbilical cord is delivered along with the baby, and still the placenta is attached to the woman's uterus, and it has not delivered in second stage of labor. So after the baby has been delivered, the third stage of labor commences, and the third stage begins after the expulsion of fetus and ends with the expulsion of placenta and membranes. It also involves the control of bleeding as well. A third stage lasting more than 30 minutes should be considered abnormal. Yeah, the after the birth of the baby, the placenta should be delivered within 30 minutes. The longest time for the delivery of placenta should not be more than 1 hour. So the placenta should be delivered within maximally within 1 hour of delivery of the baby. So delivery of placenta can occur physiologically as well as actively. If placenta is not being delivered naturally, then there are techniques in obstetric textbooks. The one of the most commonly used techniques is controlled cord traction technique. I cannot go into the detail of this technique because it will go beyond the scope of this lecture, but this technique should be known by you that if the placenta is not being delivered, then there is a technique called controlled cord traction. And sometimes IM oxytocin can be used in correct recommended dosages to assist in delivery of placenta as well. So expulsion of the placenta occurs, then there are contractions of the uterus, and then expelled placenta is seen in the infographic and can be seen in the infographic diagram. So the placenta is the part of the amnion, which supplies the oxygen as well as all the blood, all of the nutrients to the fetus. So this placenta provides oxygen to the fetus and all of the nutrients coming from the bloodstream of the mother to the fetus. So this placenta is basically the logistical supply chain of the fetus, and after the delivery of the baby, it should be delivered as well. So, when the baby is born, the umbilical cord is attached with the placenta inside the womb of the mother. Baby is put onto the mother's chest. If baby's cry is normal and breathing normally with no resuscitation needed. So, if a baby is normal, he or she has cried normally and is breathing normally, then there is no resuscitation needed, and you just clean the baby as soon as possible, and the baby is put onto the mother's chest so that there is skin to skin contact, and this skin to skin contact helps the baby to calm down, as well as it also releases oxytocin, which is love hormone in the mother as well. And when that oxytocin is released in the mother, it helps in the delivery of the placenta as well, and that oxytocin also helps in the contraction of the uterus as well, and that oxytocin decreases the risks of postpartum hemorrhage as well. So baby should be directly put onto the mother's chest if there is no resuscitation needed and the baby is normal. It should be brought back to the mother as soon as possible. Only then the umbilical cord is milked from the mother's end towards the baby. So this is a fairly new technique that the umbilical cord should be milked from the mother and towards the baby, and it supplies some extra 30 to 50 ml of blood to the baby, which has been pooled into the umbilical cord. So it should be milked towards the baby from the mother's end, and it's cut near to the baby's umbilicus after applying an umbilical cord clamp. The other end of the cut umbilical cord is then also clamped with a strong, straight artery forceps because it is still attached to the placenta inside the wound to avoid blood loss. And then umbilical cord can be easily cut. Then there is a fairly new technique being practiced in the Western world, and that is called the water birth. So water is a conductor of heat, which helps ease pain from contractions because it improves blood supply to muscles, helps transport endorphins around the body, which act as the body's natural painkiller, transports love hormone oxytocin, which accelerates and shortens labor, encourages active birth, avoiding constant localized pressure, example given from delivery bed. Therefore, reduction in pain as equal pressure and force to all body surfaces. So, there has been extensive research done to the water birth, and those who have experienced the water birth, they think that the water birth is easier than giving birth on a delivery table. But there are different schools of thought. Some people think that there is no difference between the water birth and delivering the baby on a delivery table. But there are some schools of thought, there are some researches done which consider water birth to be more easier for women and more superior than to the giving birth to the baby on a delivery table. Then there are some types of assisted deliveries, which I thought I should cover. And these assisted deliveries are of two types. One is forceps delivery, and the second is vacuum extraction. So in the images below, there is ventouse cup, which creates a vacuum when it is applied onto the baby's head. And when there is negative pressure, and you start pulling the vacuum outwards, then it starts moving the baby downwards towards the birth canal as well. So if a woman can't bear down, if a woman is exhausted from prolonged labor, and the baby is stuck in birth canal due to some reason, then the delivery can be assisted by a trained birth attendant, an obstetrician or obstetric nurse, and it should not ever be done at home or without the presence of any trained birth attendants. So assisted birth is when forceps or a ventouse suction cup are used to help deliver the baby. Ventouse and forceps are safe and only used when necessary for you and your baby. Your obstetrician or midwife should discuss with you the reasons for having an assisted birth. Your consent will be needed before the procedure can be carried out. Yeah, forceps cannot be touched to your baby's head, or a vacuum cup cannot be touched to your baby's head without your consent. If you are exhausted, if there is some suspicion of arrested labor, then these procedures are carried out after taking consent from the mother. A cut called episiotomy may be needed to make the vaginal opening bigger. So sometimes the baby is about to get delivered, but the vaginal opening is very narrow for the baby's head to get delivered. Then there is a cut given according to proper surgical technique, according to proper obstetric guidelines at 7 or 9 o'clock. I think I don't remember exactly the positions, but there are some exact positions written in the obstetric textbooks, that where should the episiotomy cut be given to increase the diameter or to increase the gap of the vaginal opening, and it helps in the delivery of the baby in the to get delivered through the vaginal, because if there is a tear of the vaginal canal, or if there is a tear of the vaginal opening, the patient may bleed severely. So um, an episiotomy cut, especially in primigravida women, or especially in nulliparous women. So primigravida is the one who hasn't given birth to any baby prior to her uh, dead birth, the one she is giving. And nulliparous is mean any woman who hasn't been pregnant before. So any tear or cut will be repaired with stitches after the baby is delivered. So these are the types of assisted deliveries: section cup, forceps delivery, or episiotomy. So all of these things are to be done in a hospital floor and not at home. Monitoring of the baby during labor is also very, very important. So throughout the labor process, the baby's heartbeat is monitored through a Pinard stethoscope or a sonic aid intermittently. Pinard stethoscope is put on mother's belly, and the baby's heartbeat is heard by a trained professional. It is very difficult to hear baby's heartbeat through a Pinard stethoscope, and you need a lot of experience to differentiate between baby's heartbeat and some other sounds. In the first stage of labor, it is done every 15 to 30 minutes, especially during or after labor. In the second stage, this should be done every 5 minutes. The patient may also need to be monitored continuously via CTG machine. So a tachography machine measures your baby's heart rate. At the same time, it also monitors the contractions in the womb, uterus. CTG is used both before birth, antenatally, during birth, natally, or to monitor the baby for any signs of distress. If you are a high risk case or have any risk factors such as epidural or meconium past, etc., CTG is mandatory, and this CTG is present in secondary care institutes or in tertiary care hospitals. So you should be referred to a maternity ward where CTG services are present if you are a high risk case due to any causes. I cannot go into the details of what are high risk cases and what are the different pathologies related with the birthing process, because those are very different things and we cannot go into the details of those pathologies or those high risk cases because it will go beyond the scope of this lecture. But you should know what is a CTG. So it is a cardiotocography machine. So it basically measures baby's heart rate and amount of the contractions of the uterus. So if a baby is going into the distress, the CTG machine tells you that the baby is going into distress and you need to deliver the baby as soon as possible. You cannot delay the birthing process because the baby may, God forbid, may die inside the womb if you delay the birthing process. So, care of mothers after NVD and C-section birth is very important. For example, if a woman has given birth, then what to do? More than 60% of maternal deaths take place during postpartum period. Yeah, a mother usually dies after giving birth, and it does not happen before usually. First 48 hours are most crucial, hence length of stay in hospital health facility is 48 hours. Most maternal and neonatal complications can occur during this period. The first 1 hour after delivery of the placenta is sometimes referred to as the stage 4 of the labor as well. So what are the observations that need to be done if a patient has delivered? So the BP should be measured, the pulse and the temperature should be measured. Any signs of vaginal bleeding should be noted. So she should be checked every 15 to 30 minutes. So for any signs of vaginal bleeding, uterus to make sure it is well contracting. Monitor the aforementioned things every 10 minutes for the first 30 minutes after delivery, every 15 minutes for the next 30 minutes, and every 30 minutes for the next 3 hours. So basically, the first 3 hours after the birthing process are extremely crucial, and the first 1 hour is very, very important in case if a woman starts bleeding. So you have to keep checking after every 10 to 15 minutes so that the woman, and you have to make sure that the woman is safe. Estimate and record the amount of blood loss in third stage and after. If loss is around 250 ml and bleeding has started, observe for the next 24 hours. Then, if there is more than 250 ml, then look for the cause and treat it fast to save her life. Put a sanitary pad or a folded cotton under her buttocks to collect blood to estimate blood loss, and how to collect blood and estimate that how much blood she has lost. You weigh the cotton before putting below her buttocks, and then when the cotton is soaked, you weigh the cotton again, and you calculate the amount of blood that has come out. For example, the cotton was only 10 grams in weight, or 5 grams in weight when you put it below her buttocks. But when you uh, removed that cotton from her buttocks, the cotton was weighing around 100 grams or 95 grams. So that means that she has blood 90 mLs in that stipulated time period. And you put another cotton under her buttocks to check for any other some more blood loss, whether there is more blood loss or not. Keep mother and baby together. Encourage early breastfeeding. And early breastfeeding means the breastfeeding should be commenced within 1 hour of the birthing process. Encourage the mother to eat, drink, and rest. And this eating, drinking, and resting is in cases of normal vaginal deliveries and not in cases of C-section. Yeah, you give you give them rest, but eating and drinking is allowed in normal vaginal deliveries. Consider intrauterine device insertion. Yeah, if she wants to go for family planning, then you can consider intrauterine device as well. Encourage her to pass urine, and if she's not able to pass urine, gently pour water over her vulva. That will help her pass urine. Weigh the baby. Do not leave the mother and the newborn alone even for 2 minutes. Care of the mother continued. So, what is the hygiene that you need to teach your patient and her family members? So, the hygiene does not need to be left unattended. Any change in condition should be reported. Advise the mother not to insert anything into vagina, such as to using tampons, to wash the perineum daily, and especially after passing stools. Now, wash in an anterior posterior direction. Yeah, there. Yeah. First wash your vagina and vulva, and then you go toward your anus after passing stools. You do not come from your anus and come to your vagina because it may cause infections. Change the perineal pads every 4 to 6 hours or more frequently if there is heavy lochia. What is lochia? Lochia is blood mixed vaginal discharge that comes in the postpartum period up till 40 days. So to wash clothing pads if used with plenty of soap and water and dry them in the sun, to bathe daily and to have enough rest and sleep, to avoid sexual intercourse with your partner for the first 6 weeks. Yes, avoid sexual intercourse for the first 6 weeks or until the perineal wound heals, whichever is later. To always wash, and you always teach her to wash her hands before handling the baby. Yeah, she should keep on washing her hands before touching her baby so that the baby does not get sick from her mother's dirty hands. And the counseling should be about diet and rest. Reassure the mother that she can eat normal food. These will not harm the breastfeeding baby. Diet to be rich in iron and fiber. Discuss about food taboos, especially against the food that are nutritionally healthy. There are many food taboos all around the world that the new mother should not eat this and should not eat that. That thing creates gases in the abdomen of the baby and things like that. But the healthy diet should be encouraged. Talk to family members like mother-in-law or husband to encourage them to ensure that the woman eats enough and avoids heavy physical work. Take care of the mothers so that she can take care of the baby. Counseling on diet, especially for adolescent mothers. Iron folic acid supplementation. IFA stands for iron folic acid supplementation. So women with normal HB are advised to take one iron folic acid tablet daily for 3 months. But if HB is below 11 gram per deciliter, advise her to take two iron folic acid tablets daily and repeat HB after 1 month. And if HB is still low, you can go for IV iron as well in a hospital setup. Family support, especially for girl child, is important, especially in third world countries, in developing countries, or in underdeveloped world, because the girl child is considered a curse in many parts of the world. And the postnatal visits are very important. So in our part of the world, the homes visits are done by family health workers. So these should be at least 3 visits, but the standard guidelines for uh, home visits are different for different deliveries. For example, if there was a home delivery attended by a trained birth attendant, yeah, home delivery is common in Pakistan, India, Bangladesh, or Africa. So home delivery, if there is a case of home delivery, there should be 7 visits by birth attendants. And if there is an institutional delivery, normal delivery, then there should be 6 visits. And there is no visit on day one, but all of the visits in 3, 7, 14, 21, 28, or 42 days, this should be there. The visit should be there. And if the baby has been born through lower segment C-section, LSCS stands for lower segment C-section, then at least 5 visits should be there. There should be no visits on day one and day three, because most of the time the patient is discharged on day two of delivering the child. So there is no need for third day visits, but the visits should start from fifth or seventh day, and they should commence just like 7, 14, 21, 28, or 42 days after the birthing process. And postnatal examinations are also important. Health checkups of the baby should be done twice a day during first 3 days, and then once a day till umbilical cord drops off, and then at the end of 6 weeks. The checkup of the mother should be done to check involution of the uterus. Involution of the uterus means that whether the uterus has contracted to the pre-birth levels or not. So, why are postpartum checkups important? So, the postpartum checkups are very important to discuss required vaccines for the baby, to monitor the mother's blood pressure, especially if she faces any issues during or after delivery, to examine the incision position and the stitches in case of cesarean section or any surgical intervention, such like episiotomy, to discuss how to regulate the menstrual cycle, to discuss vaginal discharge, especially if it is persistent. To discuss possible contraception methods, to discuss mother's general and emotional state. Yeah, emotional and psychological well-being is also important. So you do assess whether she is mentally okay or not, to monitor the mother's health and overall recovery. So all of these things are important. That is why postpartum checkups are important. So the woman should be taught about the changes in body after birth. So your body, after you give birth, your body will take its time getting used to not being pregnant anymore. Yeah, 9 months. For 9 months, a woman is pregnant, and all of a sudden, she's not pregnant. And when you deliver vaginally, it usually takes about 7 to 10 days to recover your energy and feel you are able to feel like you can do activities of daily living, and can take up to 6 weeks for cesarean section. Now, natural vaginal delivery is a blessing because you can get normal within 7 to 10 days. But in case of C-sections, you need at least 4 to 6 weeks to feel like you can do all of the daily activities normally. You will be bleeding. It will be quite heavy at first. This will carry on for a few weeks and will gradually turn a brownish color and decrease until it finally stops. Use sanitary towels, not tampons, for the first 6 weeks after birth, because tampons can increase your chance of getting an infection. So, postpartum changes in body should be taught to the woman. They should know that these kind of changes will occur in their body as well, just like all other women. And they should know there will be a fatigue. Caring for a newborn can be exhausting, and many women experience extreme fatigue in the weeks and months after giving birth. Emotional changes, hormonal fluctuations, and the stress of caring for a newborn can lead to mood swings, anxiety, and depression. In some changes, yes, there are postpartum blues and postpartum depression as well. We will discuss it later, but there are many. emotional changes happening right after the birthing process, and that they remain till 2 weeks for 3 weeks period. Bladder and bowel changes can occur. Women may experience urinary incontinence or difficulty with bowel movements after giving birth. The vaginal bleeding will be there. All of the hormonal changes will be there. All of the hormones which were high during the 9th month gestational period, they will immediately and suddenly drop down, start dropping down in the bloodstream, and they drop rapidly after childhood. This can lead to a range of physical and emotional symptoms in the body of a woman, and she will feel depressed, or she will feel elevated, or she may feel insomniac, or she may feel sleepy all the time due to these hormonal changes. And these might be disturbing, especially for a woman who has given birth for the first time. Hair loss. Women may experience hair loss or thinning several months after giving birth. Breast changes. Milk production begins shortly after childhood, which can cause the breasts to become swollen, increase in size, and they may become tender if the milk is not being is not being given to the newborn. Skin changes. Pregnancy related skin changes such as stretch marks, darkening of the skin may be present. That uterine contractions are still present because the uterus keeps on contracting and starts getting back to the pre-pregnancy size. Discomfort in the perineal area, especially after episiotomies or any kinds of surgical interventions are there. Patient keeps feeling pain even after normal vaginal deliveries because there are many minor tears. So the patient, it's difficult to pee, it's painful to pee, especially during first 3 to 5 days. It is very difficult to move, it is even difficult to wash the perineal area. So the woman should be taught about how to cope with this problem in the first few days after delivery. Then there is a problem with the fluid retention. Some women may experience temporary fluid retention after giving birth, which can lead to swelling in the legs and feet, but these things settle on their own stipulated time. So, the last topic of our today's lecture is common postpartum complications and how to avoid them. I could not add all of the postpartum complications, but I have added the most common ones. So, the one of the most common presenting complication that occurs immediately after delivery is retained placenta. So typically the placenta detaches from the uterus within 5 to 30 minutes of the delivery. Sometimes though the placenta or a piece of the placenta stays inside the uterus, if the placenta is not entirely delivered 30 minutes after birth, this is called retained placenta. A retained placenta places you at increased risk of infection and hemorrhage, and therefore it has to be removed. So if a piece of placenta was not delivered properly and the trained birth attendant or your healthcare professional missed it, you may start having fever, foul smelling vaginal discharge. Larger pieces of tissues coming from the placenta will keep on coming from the vagina. Heavy bleeding may be there, pain that does not stop. So the treatment of retained placenta is to remove the remaining pieces. So you must be given medications to help encourage uterine contractions, or your provider may try to manually remove them so that the problem gets solved. Then there is another life-threatening postpartum complication, and that is postpartum hemorrhage. A postpartum hemorrhage occurs when a woman continues to bleed heavily after delivery and is typically diagnosed after a mom loses 500 ml of blood. It's not 1 liter of blood. It's in our textbooks, from what we have read, it's usually 500 to 750 ml of blood. We can't wait for 1 liter of blood to be lost before labeling any woman having postpartum hemorrhage. Usually, if more than 500 ml of blood is lost, we call it postpartum hemorrhage. Whether it's mild or not, we will discuss later, but if there is blood loss of more than 500 ml, it is an emergency. Generally, this occurs immediately after birth, but in rare cases, it can occur up to 12 weeks later. The most common cause of postpartum hemorrhage is that the uterus does not contract properly and some blood vessels remain open after the delivery of the placenta. But it can also occur due to tears in the uterus, cervix, or vagina. What are the symptoms? So, cervix is the symptoms are significant bleeding after birth. So, what is the treatment? So, the treatment of postpartum hemorrhage is true obstetric emergency, and I cannot go into the details of postpartum hemorrhage management because the hemorrhage management is entirely another topic. You can even deliver an entire class dedicated to the management practices for the postpartum hemorrhage. Some other common complications we have already discussed, so I will just briefly touch them. So the difficult urination is there, and there is a constipation. Yeah, constipation. Almost every second mother, yeah, more than 50% of the women experience constipation immediately after delivery. And the problem with the constipation is the woman is not taking plenty of fiber. She's not taking fresh fruit. She's not taking vegetables, and there are many food taboos that you cannot eat this fruit, you cannot this vegetable, you cannot this thing, you cannot eat that thing, you cannot eat that thing, you shouldn't go near to that thing, and all of these things. When a woman's diet gets restricted, so the constipation problem starts, and that constipation becomes so worsened that sometimes she even can't pass stool after 3 or even 5 days of delivering a baby. And that creates a fullness sensation in rectum and extremely painful sensation. She cannot bear down, she cannot evacuate her gut, and she completely gets exhausted due to this problem. And then there is a swelling in the body, especially in ankle and feet, and it can get better if you advise her pillows below her legs when she go to sleep. Energy levels immediately go down because there is no more hormonal rush in the body. And then there is a problem with the stitches. If there are stitches due to episiotomy or due to C-section, then the stitch care is important. The dressing should be done daily. The hygiene should be very good. The stitches should usually dissolve by the time the cut or tear has healed, but sometimes they have to be taken out. Women worry about the pain or stitches breaking when they go to the toilet, but it's very unlikely that you will break them or open the wound. But stitch care is important. Just like any surgical wound, you use antiseptic solutions, you keep washing the area, you keep the area clean, and follow the surgical guidelines as advised by your obstetrician. Breastfeeding after birth, there are some top tips and advices. I will not go into the details, you can read the details later, but these guidelines are very important for especially for primary gravida, for especially for first time mothers. She should know how to properly breastfeed their mm, offsprings, how to properly breastfeed their newborn babies, because sometimes the improper techniques and improper methods and improper diets and improper timing regimens and improper methodologies result in baby leaving the mother's milk at all, and that problem creates a gap in the nutritional status of the baby which can't be fulfilled, because the nutritional status of the baby depends upon the breastfeeding. And if a mother does not breastfeed her baby, the void or a gap in his or her life will remain forever. So, the last topic of our today's class is postpartum depression. So, it's a very debilitating condition, it's a very painful condition. Sometimes, even uh, woman wants to kill herself or kill her babies, and it's a very debilitating state, and so it should be treated, and there should be proper knowledge given to the healthcare professionals how to deal with the postpartum depression. So hormonal changes that peak in the third trimester of pregnancy and then drop dramatically after birth. Having a newborn brings lifestyle changes that can be physically and emotionally taxing. Sleep deprivation, new responsibilities, stress and anxiety, the baby waking up mother all the time, and all these things may worsen the mother's mood. Genetic and environmental factor can make a person more vulnerable to developing postpartum postpartum depression, including previous experience with depression or postpartum depression, family history of depression or postpartum depression, depression during pregnancy, difficulty becoming pregnant, being a mom to multiple babies like twins or triplets increases the chances of getting depressed because they drain you physically and mentally. Being a teen mom, yeah, if you are a very young mom, then you are at risk of becoming postpartum, contracting postpartum depression. Preterm labor and delivery are also linked with postpartum depression. Pregnancy and birth complications such as vaginal tears or any other complications such as postpartum hemorrhage, going into coma, going into ICUs, or if your baby has been hospitalized for 3 days, for 2 days, for 4 days due to some early onset sepsis or due to some breathing problems, and you can't see your baby for 3 or 4 days after birth, then all of your hormones and all of your emotional well-being gets disturbed, and the postpartum depression can strike you hard because you keep crying all the day for your baby and you have given birth but you can't see your baby, so that experience is extremely traumatizing. Postpartum depression psychosis. So conditions such as baby blues, postpartum depression, and postpartum psychosis are very different. They're not very different, but they are different and they should be treated differently. So the baby blues are fairly common. There are mood swings, sadness, anxiety, irritability, feeling overwhelmed, and the urge to cry at every minor thing, appetite issues. Sometimes they want to eat everything, sometimes they want do not want to eat anything at all. Then there are some troubles sleeping as well. Sometimes there is insomnia, sometimes there is um, uh, extreme feeling of sleepiness all the time. Then the baby blues usually last from few days to 2 weeks after childbirth. So after 2 weeks, the baby blues should settle. Call your doctor if you experience any of these symptoms longer than a week or two. So, what happens when you start calling baby blues as postpartum depression? So, experienced by approximately 1 in 7 new mothers. So, there are severe mood swings, difficulty bonding with your baby. Yeah, you do not feel love towards your baby, withdrawing from friends and family. You do not want to talk to anyone. There is severe insomnia or sleeping too much. There's overwhelming fatigue. You are bedridden. You do not want to even go to the bathroom. There is intense irritability and anger, anxiety, or even panic attacks, thoughts of harming yourself or your baby, feeling of restlessness, shame, guilt, or inadequacy. So these are danger signs, and these should be treated by a proper psychiatric care facility. Commonly starts within 1 to 3 weeks after delivery, but can occur up to 1 year after delivery. Symptoms can last several months to a year. Call your doctor if you experience any of these symptoms. Treatment options may include antidepressants, brexanolone, and talk therapy or support groups. And what is postpartum psychosis? Postpartum psychosis is a very rare phenomenon, but is a life-threatening emergency. Confusion and disorientation, obsessive thoughts, hallucinations and delusions, excessive energy and agitation, paranoia. Paranoia means you become negative about all the people around you. You think your mother is your enemy, you think your husband is your enemy, you think your mother-in-law is your enemy, you think your sister is your enemy, your doctor is your enemy. All of these people are there to harm you, and you start attempting to harm yourself or your baby. Then you are a psychotic person if you are experiencing any of these things, and you need immediate help without wasting even a single minute. Symptoms typically develop within the first week after delivery and can last up to several months. Immediately seek help from your partner or loved ones and call emergency helplines of your country. In the United States case, you call 911, but in other countries, whatever helplines are there, medications and intensive inpatient or outpatient treatment may be needed by such patients. Have a nice day.